Step 2, female health. So this is part of baseline workup. After getting a referral from your GP, you see your fertility specialist. Your fertility specialist wants to know if you have any medical conditions, and if you do, then they want to analyze if those conditions can have any negative impact to your IVF treatment and future pregnancy. And also they want to modify negative impact so that your overall health will not be impacted, and also you have healthy pregnancy. So in terms of effect of different medical conditions to your fertility in IVF cycle and pregnancy, it can be two-way street. So some medical conditions can impact your fertility and IVF cycle and pregnancy, and vice versa. Actually, IVF cycle and pregnancy can impact your medical conditions negatively as well. So overall, the interaction between disease and medications on one side and your fertility treatment and pregnancy determines whether you will have a straightforward IVF treatment and healthy child. So we will be mainly focusing on most common medical conditions. So the first thing your fertility specialist pays attention to is your body weight and your BMI. Ideal BMI when you're trying to get pregnant is approximately between 18 to 30, and hence a lot of IVF clinics do not offer IVF treatment if your BMI is higher than 35. So you need to see your fertility specialist and GP and dietitians to try and address BMI issues before you start IVF treatment. So mental health is very important when you are going through IVF treatment, because treatment itself can be very stressful. You need to have a support system in place among your friends and family, and also you need to speak to your GP. If necessary, you need to modify your mental medications if you're on any medications for mental health issues before starting IVF treatment. So also your fertility specialist will check if you have anemia by checking your iron levels, vitamin B12, folate, hemoglobin levels. If you have anemia, then they will address by treating it. And they also check your thyroid function, because hypothyroidism very common in women who suffer from infertility, and ideal TSH should be 2.5. They can use thyroxine to achieve optimal thyroid function before you start IVF treatment. They check whether you are prone to have a diabetes by checking your sugar levels, and they go through your surgical history. So they want to really understand whether you had any surgical operations in your pelvis and abdomen which may impact your IVF treatment. And also, if you have any medical condition, they will understand whether those conditions can negatively impact your IVF treatment, and if you're on any medications, they want to know and understand whether this is contraindicated for pregnancy. So then, very importantly, they will try and understand your lifestyle factors: diet, smoking, whether you use recreational drugs, alcohol consumption, and level of physical exercise. And they will give you appropriate advice in terms of being in most optimal lifestyle conditions to achieve successful and healthy pregnancy. So it's very important to tell your fertility specialist if you have any medical conditions, if you're on any medication, so that your specialist will modify their negative impact to your IVF cycle and pregnancy, so that you will achieve healthy and successful pregnancy.